Good morning, Howard. How are you today?
Hey, good morning. How are you today?
Good, good. Welcome to our first official podcast. The pilot we did previously was simply a pilot. Hopefully by now we've got our mechanisms in place where we can provide a better product and we can not banter as much back and forth with each other and still have a really good time. Our
I
goal
like
today,
bantering. Bantering's not bad.
well,
Little bit.
it's so easy to banter with you, though. I mean,
It is. I mean, you want to stay on topic a little bit, but just go with the flow.
Yeah. Well, we got a great guest this morning.
Absolutely.
So with that, anything new with you before we bring in our guest? Anything new that you want to share?
We got all the Christmas decorations down. That's new. And it's only, 11 months away for the next one.
Well, we had a busy week since we last talked. A lot's going on here. We're getting ready for the NCSLI Technical Conference in a couple of weeks.
Oh, yes.
Yeah, NAPT will be heading to that. I think with no further ado, we probably should think about bringing Paul in. So let me try to give a brief introduction to Paul. Our guest today is Paul Reese. I think just about everybody in the metrology community, when we say the players, if you're anybody who knows anybody, Paul Reese. Paul Reese is the Cal manager for AbbVie, and he's in the private sector, but he is well known throughout the metrology community, well respected. Paul graduated from the University of Central Florida in 1993 with a bachelor's degree in electrical engineering. He's got over 30 years of experience. He spent 18 years in metrology working in the primary standards lab at NASA Kennedy Center. So I think you guys actually might have worked together.
That's where I first met Paul. Correct.
Okay. In 2012, he left the aerospace industry and joined the pharmaceutical industry, where he currently manages the standards and calibration labs at AbbVie in North Chicago. He is extremely active in NCSL committee, has published numerous papers on measurement decisions risk. Paul has also contributed to the development of the ANSI Z540.3 handbook and the ISO 17025 handbook for calibration labs. And with no further ado, there he is. Good morning, Paul.
Reese.
Welcome to the podcast.
Welcome to the show.
Hey, thank you, Chuck. Thank you, Howard. Good to see you guys again.
Yeah. Look at all that fancy gadgetry behind you. Exactly what I expect from an electrical
That's
engineer.
all broken.
So
That's why it's flickering.
You're both musicians, so you both play instruments, right?
Do you say magicians or musicians?
Musicians.
Is there a difference? No, Howard is a musician. That's a fact, not me.
Oh, I beg to differ, Mr. Reese.
There's a difference between being a fan of music, which I definitely am, and being a musician, which is
I've heard you referred to as a musical prodigy.
No, absolutely not. Whoever told you that gave you false information.
Well, then share with us your skills as a musician. What instruments do you play?
Well, that's a short list. Okay, back to you guys. No, it's funny how for some reason metrology does seem to attract, kind of people that are musicians and stuff. I don't really consider myself in that group, but half the guys I know in metrology really, Greg Sinker, you talk to that guy is an incredible guitar player,
That's awesome.
Off the top of my, just some of the guys, probably half the guys I work with are into, drum.
Metrology musicians. Why haven't we started a band?
Well, yeah, right. NASA had that band. You remember, Howard? That was like all astronauts.
Yes,
and I always thought they had the coolest name. Like I'm horrible at coming up with cool names. I'm so uncool. But the band name for the NASA astronauts was Max Q.
Max Q. That's
Max
right.
Q is it's what rockets go through when they hit the point of maximum dynamic pressure.
Correct,
on a launch, because their speed is increasing, so pressure's always increasing until the atmosphere thins out, and then there's very little pressure on it. But that point, which is like the maximum stress on the vehicle, and that's when they usually throttle back the engines just to prevent excessive loading. So I always thought Max Q was like the coolest name.
It is very cool. So I still have my stack of memorabilia from KSC when we worked there. I've got the stack of newsletters that we got all the time out there. And
that's awesome.
At that picnic that one year, 94, I'm going to say, maybe 95. So I had my daughter and my wife there at the picnic. Max Q was playing, and then they took a break, and they took a picture for the cover of KSC newsletter with one of the musicians and astronauts, right? And my daughter. And it was really cool. Yeah.
That is so neat.
That is fun.
Oh, that's cool.
How many launches have you guys seen?
Oh, That many.
Wow.
One? Howard, you only saw one lunch?
See the stack right there?
Oh, yeah.
That's probably 100 or so.
You saw 100 lunches.
We've seen a lot.
Wow. You
Yeah.
too, Paul?
Yeah. Well, I don't know if I've seen 100, but I've definitely seen a lot. I mean, if we were out there during working hours when there was a launch,
Yeah.
we worked in a building. Howard and I both worked in a building called the CIF building, or the Central Instrumentation Facility, and that building was like purpose built as a metrology calibration instrumentation lab, and kind of no windows on the outside, typical late 50s construction, built like a tank. And back then, before, safety became such an incredibly big thing, we would all go up on top of Howard, what was it, a 3 or 4 story building?
Four-story building. We'd
Four-story
go up on
building?
the roof.
Yeah,
to watch
kind
the
of a
launches.
flat top.
Yeah.
Yeah, and I heard different estimates about how far that building was from the launch pad. Is it like 4 miles, Howard? Something?
I've heard 5, maybe it's 4. I don't know exactly, but
Something
it was
like that.
pretty close, right? For a launch, it's
Yeah.
pretty close. Enough
Yeah.
that all the windows would rattle, right? When the space shuttle went up. Let alone, I would have loved to have stood there when Apollo launched. That would have been amazing.
Oh my gosh, yeah. Yeah, when Howard and I were there were a few guys that were there, like Woody Trammell, Thomas Brown.
Yeah,
I
Jim
think
Tidwell.
They were both there. Yeah, Jim Tidwell. All those guys were actually there during Apollo. So that was kind of cool.
That's the thing about working out there. How cool is it to get that kind of a job, right? I was just starstruck when I accepted that job. Actually, I turned it down first. And then a week later, I said, hey, I reconsidered. And they said, well, we were just about to call the next candidate. All right, the job's yours. Anyway,
that's awesome.
Just working around those guys that had been through all the original stuff, right? And they wouldn't just talk to you about it. You had to pull it out of them, right? You had to strike up a conversation and get them to talk about it because it was just every day to them.
Yeah.
Right. But some really cool stories that they had. And met Alan Shepard, right? Remember, were you there when he launched that 1/500th scale
no,
rocket
if I was
from the building?
No, I wasn't.
I think it was just before you started, right in front of the CIF in that open field. And he launched that as a commemoration of 30 years, I think, since his flight. Yeah, that was 91. So that was before you got there.
Yeah. Yeah, so you were there before I was. I joined in 94, so that would have been a few years before.
Yeah, there's some cool things that we saw out there.
Yeah, one of our mass metrologists, Mary, she used to work in our math lab. She played tennis and was a tennis partner to Werner von Braun.
Oh, really?
Crazy.
Wow.
Mary was a senior lady when we were there. Werner von Braun was one of the German scientists that worked on the V2 and
V2
developed the V2. And so after World War II, German scientists were in high demand. And he was one of the people that came over that really started the space program at Kennedy and at NASA, his whole. So he was
key to it.
Between him and Robert Goddard, they're the fathers of rocketry for sure.
Let's pull forward a little bit. Paul also sits on the board of directors for ChatNAPT. He is the director of Captive Labs. And so the question that's always asked of you, what have you done for me lately? So tell us how you are enjoying your tenure, if you will, on the board of directors, and what are your plans? Do you have any plans of what you hope to bring to the association?
Oh yeah, it's just a super honor to be on the board of ChatNAPT. It really is. It's a great organization. When you look at the staff and the BOD, there's just some incredible people on there. It's great to be associated with those folks. In all backgrounds. I don't think there's any single area of metrology, calibration, measurement science, traceability that the staff and the board don't bring to the table. It's kind of almost like a who's who of metrology.
And I'm so glad you were able to accept the appointment.
And thank you for the invitation, Howard. Yeah, metrology, we always say it's a super small community. A lot of technical people don't even know what metrology is. They spend their lives in, some form of science or something, and they don't really know metrology or understand it. So, yeah,
I call it 2 degrees of separation, right? You either know somebody directly or you know someone they know.
Yeah, very, very true. It's just astonishing sometimes how, the commonalities in people's history when they, and Howard was in the military. And once you, throw that female kind of military aspect into it, it very is like that. They were stationed at the same place, or they were roommates, or they were in basic training or something like that together.
You got it.
So,
yeah. Well, one of the the things that the board, you mentioned the board is a very versatile group of people.
Yep.
The common misconception that a lot of people have about NAPT is that they only do a limited number of calibrations, proficiency type kits, which really isn't the case, because like you said, one thing that NAPT does do is we have disciplines, we have kits for all the disciplines, and we service the entire metrology community, large organizations and small. We're not, singular to a single company. We service the entire, community. So NAPT, has 580 members. So there is this plethora of people that's a wide variety of people that we service. That's why the board was designed, as Howard mentioned earlier, to make sure that the entire community is spoken for at the leadership level as well. So that's important.
And in particular, your role is to represent the interest of internal labs within manufacturing.
Yeah.
What we got to do, Howard, we got to get Paul to design some experiments for the pharma companies, so we can get the FDA to become ISO 17025 accredited. We get the FDA behind that. What do you think about that, Paul? Getting the
Get them
FDA
drawn
behind.
in.
Yeah, you kind of asked me what I bring to NAP, and hopefully some value. But yeah, ever since I left kind of aerospace and got 2012 is when I really got into pharma and med device and this whole biotech kind of sector, and it's super interesting, and it's a super important field, right? I mean, like all fields are absolutely important, space, defense, but it's definitely they're all fields where people's lives are at stake, right? So one question I've always posed, because strangely to me, when I got into this field, the FDA does not really require 17025, certainly not accreditation for internal labs or for external labs. We use Transcat quite a bit, which Howard, I think you know something about Transcat, but so we use Transcat as an external lab, and they're a fantastic lab. But really, there's nothing stopping us or any other internal calibration lab that works for a biomedical or med device company from sending it to just about any lab. Even ISO 17025 compliance for labs is not really mentioned anywhere in the regulations, right? So, I'll be gentle when I talk about this subject, but it is something that's just inside me all over, because I ask this question all the time to the folks at NCSL conferences and my work and everything. It's like, if med device and, biomedical pharmaceutical companies, if their equipment is not required to be calibrated by an ISO 17025 lab, who should be? Is there a higher level of importance somewhere out there that we're missing, and that we're just so if we shouldn't be required to comply with those documents, and again, the accreditation is kind of that second step, but compliance would at least be, the first step. And one of my things, years ago, I wrote a paper that kind of delved into some of the government requirements that the federal government really doesn't want the multiple hundred agencies of the federal government writing their own requirements, writing their own government unique standards. The government in general, like White House Office of Management and Budget, wants government agencies to take advantage of voluntary consensus standards, right?
Mhm.
It was OMB, I think 119, A119. There was a circular that came out previous to a federal law that was passed, and that's the National Technology Transfer Advancement Act of 1995, and that requires federal agencies to use voluntary consensus standards when carrying out the course of their especially regulatory responsibilities and stuff. And so it would be far easier, rather than having all this verbiage in about a half a dozen different sections of the Code of Federal Regulations that specify all the requirements that medical device and pharmaceutical companies have to follow. It's Title 21 is that section of the CFR. And instead of writing all those calibration requirements, they could simply say test measuring equipment shall be in accordance with or in compliance with ISO 17025.
Mm-hmm.
And that would be essentially it. And that's really all they would have to say. In fact, I think it's Title I of the Code of Federal Regulations is something called incorporation by reference. And what that means is it kind of tells all the different federal agencies that get a title, get a slice of the CFR, Code of Federal Regulations. Title 1 tells them, hey, look, you don't need to go it alone. You don't need to develop all of these requirements, for any multitude of things. The FCC is kind of a good example of this, right? The FCC has a lot of requirements that, manufacturers have to follow, people have to follow, everybody has to follow. But, FCC actually invokes or incorporates by reference ISO 17025 into their section of the CFR. And so that's really kind of, what I think personally, that it would be a solution in our industry. Because if you don't have that, right, and you don't have this very astute, well-written document that in itself invokes other ISO documents that kind of form the pillars of the foundation of metrology, you get into, situations that are basically untenable that I have been in before. And that is, so the CFR says you have to use traceable instruments, right?
Oh,
What
yeah.
does that word mean?
Specifically, 21 CFR 820 for medical device. Good example, right? Very big. Instrumentation must be suitable for its intended purpose and capable of producing valid results. And that's it.
Yeah.
That's all the further they go, and you have to interpret what that means.
Yeah. Now, there is some guidance that they have put out. And basically, they say what that kind of means is that instruments should be qualified. But are you going to qualify a micrometer or a 6-inch steel ruler or a Fluke 87 digital multimeter?
Yeah.
You typically don't qualify those instruments. So in my mind, in the FDA, a sister organization of the FDA is the United States Pharmacopoeia. And they have some really sharp folks in that organization, especially, I think it's the Reference Standard Materials Committee. And so some of the group members of that committee, anyway, have written some great papers that kind of interpret what does suitable for its intended use and capable of providing valid results mean in the context of test and measuring equipment and making measurements. And it's a beautiful kind of understanding about that, because it takes what Howard just read, something that's kind of nebulous and amorphous, and nobody really, there's 1,000 different interpretations of what that means. Does it mean you have to qualify it or validate it, or, what does it mean? And when you think about it, what is a valid result? They're suitable for its intended use.
Right.
And in metrology, it's like these really elegant answers can be brought to bear on that. And
so I just want to correct you on one thing there. I didn't read that. That is etched in my heart.
Yeah, that's really good. Yeah, absolutely. That is probably one of my most quoted phrases from.
Yeah. So, I mean, when you look at that and you think of 17025 and what the intent there is, right? And the definition of traceable measurement to include measurement uncertainties, because how could you say that you have a valid result if you don't consider the variability in the measurements?
Absolutely.
And that's what the uncertainty represents. So, people struggle with that, and they want to throw that out and say, well, that's only for standards, right?
That's right. And that, Howard, that's such a good, kind of intro to it, because the variability in the measurements kind of goes into is kind of a subset of what is the uncertainty, of that measurement. And then you ask your question, especially in our field, what is the primary benefit of a measurement uncertainty? And the answer is it allows you to evaluate if it's suitable for its intended use.
There you go.
So, we have something called, test uncertainty ratio. And at least in the Americas, this idea of 4-to-1 test uncertainty ratio is kind of baked into the psyche from the 1950 military days. It's kind of a pseudo risk mitigation technique, but really that's the answer, is an instrument is suitable for its intended use and capable of providing valid results if the decisions that are made on those measurements have an acceptably low risk of being incorrect.
Correct.
If you're looking at an evaluation about, is it intolerance or out of tolerance? Did this experiment or this clinical study, did it pass? What are the tolerance limits? Okay, well, it's good if it's below this value. Okay, well, what's the measurement uncertainty of that value, right? And so all measurements have uncertainty, so all decisions have risk. That's kind of just baked in. And that's something that is, even in itself, we're all so steeped in that lore But even some astute quality folks don't really understand that when you make any measurement and you make a decision on that measurement about what to do to treat a patient, to give some medication, to diagnose somebody, or in or out of tolerance, or did a study pass or fail? There's a chance that you're wrong. If you say, "Oh, this study passed with it's
and
good."
that's the whole purpose of the traceability chain. The whole reason for it, from the top end at the SI unit definitions to the measurements on the product or the patient or the customer or the product, right?
Yep.
That whole process is built to make sure you're not making bad decisions on acceptance or pass fail or whatever. And you can't have that without that other piece in there to say how much variability could throw me off to where I'm wrong about that.
That's right. And that
I
that in and of
got to ask you
itself,
guys a question. So the importance is there, right? And
It is.
Yep.
and so us in the metrology community can, we can argue all day about how important it is and whatever. But Paul, explain to me if you can, and in an abbreviated fashion. I'm hoping, because you know this so much. I'm going back 20 years, maybe more than 20 years, where the FDA has always said they're going to go to 25, ISO 25.
Yep.
Since 1725 became a standard some 28 years ago now, what is stopping the FDA from getting on board? What do you think? Is it money? What do you think is them stopping from incorporating the requirements of accreditation for 1725 into the FDA industry?
Yeah, fantastic question, Chuck. Yeah, and I can give you my opinions on it. There's probably many reasons that I'm unaware of. There's actually some documents that kind of give some indication about what that might be. And again, these indications are the same thing that makes the government want to incorporate by reference, and that is, they have limited resources, right? So they're inspectors that go out and perform these evaluations or audits, if you want to call them that. They're really inspections, but they're required to know such an incredibly wide breadth of technical subject matter, from sterilization to stability studies to I don't know, to calibration to quality inspection, sampling plans, all of the stuff that really kind of goes into that. And so they're challenged a bit. The FDA, and again, they're so big, but certain subsets or sections of the FDA certainly know what ISO 17025 is. It's not that they're unaware of it, but they are unaware of it to this amount. There is the FDA publishes a guidance document that talks exactly about that, about their use of voluntary consensus standards, and there's a whole litany of them. But 17025 is not in there. However, to my knowledge, I think it was in '96 that the FDA became aware that there had been kind of high profile court cases in which technical experts from certain areas of the government had been cross-examined in court cases, and basically, I don't want to say their technical merit was brought into question. Let's just kind of say that. And so whether that was FDA or not, that media events is, I think, exactly how the FDA put it. And so that caused them to take a really hard look. I mean, Chuck, you talked about 28 years ago, like 17025. This was still when Guide 25, I think, was out prior to the first publication of 17025. They said, we can't have that happen. We want our experts, our laboratories within the FDA to become ISO 17025 accredited. And so there was a push to do that, and they did. But the internal labs at the FDA are 17025 accredited. And there was this big push also to get state food testing labs accredited to ISO 17025. And there was even government funding made to existing labs, food testing labs at the state level that were not accredited. There was funding made to get them accredited, to help them, achieve ISO 17025 accreditation. So they're certainly aware
Speaking
of
that,
Yeah.
we have a client that's USDA regulated, not FDA.
Uh-huh.
And I won't go into the details of that, but what I want to mention there is that they are 17025 accredited for testing milk and water supplies in the US.
Yeah.
They actually have that in their facility.
Yeah.
Right? And we run their calibration lab internally. We're 17025 as well for that reason. And so we have their audits there together, which is pretty incredible. To your point, right? For some of the food testing, companies that have become 17025 and are still today.
Yeah. Yeah. And, the other, I mean, that's a great example, I think the other answer to Chuck's question is, the FDA used to be a little more involved, even in NCSL back in the 90s
Yeah,
and early 2000s.
right.
Agents from the FDA would participate, at least come to NCSL.
Oh,
In
we always had a
fact,
committee meeting. We had medical. They always attended the medical committee.
Yes.
that's right. Yep. And in fact, there was a gentleman, Gary Davidson, I think was his name. He was a gentleman that worked, as I understand it. I never knew Gary personally. I did exchange a few emails with him on this subject when I was kind of researching it. But Gary used to work with Howard Kastrup out at TRW, like in the 70s or 80s. So this is going way back, right? But Gary Davidson chaired a committee in NCSL. Trying to remember exactly what it was. It was the committee that essentially wrote the first version, your Z540.1, right? And so Z540.1 was this document that was, I think, 1996 was the first version of, maybe 95.
94 was the first
94.
version.
That's right. Yeah. Thank you,
Yeah.
Howard. That's great memory. Yeah. So 94 Z540.1 came out. And what it did, the whole purpose of Z540 at that time was to take the two competing documents that laboratories were being asked to comply with at that time.
Right.
One of those documents was ISO Guide 25, which was very soon to become
Yes.
17025. So they had Guide 95 over here that, maybe international customers, maybe, I don't know, a certain sect of requirements required them to be ISO Guide 25 compliant. And then you had MIL standard 45662A, which was the military standard that a lot of industry had adopted. I mean, that was
the standard.
I heard of 45662A before I heard of ISO Guide 95.
Prior to me coming to the Space Center, I worked for Martin Marietta, which is now Lockheed Martin in Orlando. Yeah. And we, of course, aerospace followed MIL standard 45662A, which was a 4-to-1 test accuracy ratio.
Yeah, before 25, the standard was the military standard. Yeah. Before Guide 25 came to right. Yeah.
Yeah, but when Guide 25 came out, there was something sacrosanct that was left out of Guide 25, at least a lot of people felt. And that was Guide 25 didn't say a single word about test uncertainty ratio.
Right.
Didn't even allude to this idea of measurement decision risk, or why would you need this thing called test accuracy ratio or test uncertainty ratio.
It covered uncertainty, measurement uncertainty.
Oh, right? Certainly, yeah.
And that's what 45662A was missing. It was talking more about the error of the standard and not all the rest of the details.
Yeah. So there was all these powers that kind of came together to develop, I mean, we're still trying to do this right. One standard to rule them all.
Yes.
Right.
Yes.
So, but that was on the ticket for that group that Gary Davidson chaired. Essentially became the Z540 committee to incorporate the kind of the best ideas, or the ideas that were the most heralded from those two, kind of historic documents there, and incorporate them into one document that everybody could use, that would be accepted by all government agencies, right? So there was a lot of government agencies in that committee. There was members of DOD, and there was NASA had a bunch of members on there as well. And the FDA had members that were in that committee. 100% confirmed that. There was a guy named Ted Hell that actually worked at Abbott Laboratories, which was the predecessor to AbbVie. AbbVie was that I worked for, was spun off from Abbott Laboratories in 2013. But back in long before that, at Abbott, Ted Held was one of the guys. Abbott used to write this great, Howard, you mentioned like this, the newsletters at Kennedy. So Abbott had their own like metrology newsletter that went around. Actually, I got those copies before I even joined AbbVie when I was at Baxter Healthcare. And so Ted Held, in one of those newsletters, who was a member of that committee as well, gave this great summary of like the FDA's position on Z540.1. And at first they were kind of against it because they kind of viewed it as the private sector, taking over responsibility that they were charged with, like the accreditation game or something. And but in the end, they said, they totally supported Z540.1. Now, when .1 was published, none of the members of the FDA were actually listed as authors of the document, but they certainly were on the committee. And looking through the old proceedings of NCSL, I can find papers, presentations that were given by FDA, members of the FDA. funding always seems to be a challenging thing, but at least it seems like back in the day that the FDA really was more involved. And I should say that one of the other aspects of the NTTAA, which is that law that requires government agencies to use voluntary consensus standards, one thing that it says is government agents should be on those committees that develop those voluntary consensus standards to make sure that they are suitable for the use by the government, that they incorporate all the things that government agencies
so they have
want.
a voice. Yeah,
That's
makes
exactly
sense.
right. In my opinion, it's all it is. It is a challenge for their staff to be aware of NCSL and the metrology community that exists out there.
How can we change that, Paul? How can we, as metrologists, especially you, because it affects you more than it affects us in the captive labs and us that provide services to the medical community. What can we still do now at our levels, that whether it's through the NCSLI or other type of professional society? What can we do to get the FDA back attending these meetings and get them back into the conversation? I think that's the component that seems to be missing.
Yeah, it's a really great thing, and great question again, Chuck. Hitting on all cylinders. And I want to be a little careful about exactly what I say and how much and all this stuff because it's just obvious reasons. But
Right.
there was an event. So when Howard kind of from memory recited part of the CFR, again, they use these words in the CFR like traceability, calibration, measurement standards, these kind of words. But what do those words mean? There's no dictionary that goes really along with the CFR that gives meaning to those words.
So each company then interprets into their policies what that means. And that's
right.
auditable by the FDA. And it's not hard to have an interpretation that varies from one company to another, right?
That's right.
The FDA is going to look at that and say, yep, you caught the spirit of it. You're good.
Well, and the FDA is going to interpret it like they want to interpret it, right?
Right. Yeah.
True.
So I'll just say this, talked about the subject so much, but let's just say some government agencies have interpreted the CFR that says when you calibrate an instrument, that means you adjust the instrument.
Oh,
I mean,
right.
this literally happens, right? Now, everybody in the metrology community rolls their eyes. But what happens when a federal agency says that's what that word means, right? And if you're just calibrating instruments, comparing the instrument to a known traceable standard, right? And you're verifying, that's the second step. So calibration is the first step. You compare an unknown to a known, and then you establish what the error is of that unit under test, the unknown. That's calibration, right? With a measurement uncertainty.
Right.
And then the second step is if that thing that you tested has metrological limits, right? So tolerance limits, maximum permissible errors, MPEs in the words of the VIM, then you can make a decision. Is it intolerance or out of tolerance? And even if it is intolerance, or if it's out of tolerance, you can make a decision to adjust that instrument. That's the third step. Those are three distinguished, unique, discrete definitions in the VIM, right? So because you don't have some government agencies, invoking 17025, which in itself would invoke all of these other reference documents to like bring to bear and answer this question once and for all. It's not an interpretation. Here it is. It's in a document that we all agreed to abide by, right? So what can we do, to help the situation? So there might have been an NCSL committee, that discussed this issue about some defined words, and what the definition of those were, and drafted a letter that kind of to this government agency that said, hey, we're interested in, your understanding of this and what reference documents are you using, to glean this information. Would be super interested, and we're all this kind of stuff. So I think outreach through NCSL committees, through other professional organizations that have outreach. And part of that was during that time in my life, letters were actually informally sent between people that knew people inside the agency and invited them to NCSL conferences like they used to attend, but it just never materialized. Yeah. So.
Well, we need to kind of move on. One thing is for sure here, Paul. you are going to be a recurring guest on our podcast because your wealth of knowledge is just unbelievable, and we just don't have enough
Indeed,
time in
yeah.
one podcast to begin to even touch base on everything that that you can share with us.
Well,
So
that's one of the first things I noticed about Paul when I met him at KSC, right? He just has a wealth of knowledge. He's well read,
very well, right? Yeah.
but even more importantly, he can retain so much information and recall it pretty quickly, right?
Yeah.
There's not a lot of people who can do that, and that is a gift.
Yeah, absolutely.
So to that, I asked the question: do you
Yeah.
know? Have you taken the test? Do you know your IQ? I'm just curious.
I have never taken an IQ
I've never
test.
taken it.
I would fail horribly.
Well, you can't fail an IQ test.
Well, let's just say there are some limits on. Yeah, it's such a touchy subject.
Well,
even
so
the
with that being
military
said,
has
I was taking a look at IQ scores to see, what the ranges are. So,
Yeah.
here you are down at the low end. There's some, some problems if your IQ, natural IQ is that low. You get below average, above, high, and then of course genius. Now, in the genius region, I'm going to take a guess who's up there.
Yeah,
Mr.
sure.
Einstein,
That's
right?
the first one that comes to, yeah.
And he's genius because he knows metrology rocks. So my IQ is kind of in between here. It's pretty low. And so they did an MRI because there's some concern there and found out that this is why. This is the problem.
You got good dental structure there, Howard.
That's what you noticed?
Now, Howard, I think now would be a great time to give the question and answer period to Paul about the 4 questions that we always ask our members. Are you ready with your questions?
I am. That was one of them. So just going on with that thought, the highest IQ, I just had to see this, right? Person born in Australia, Adelaide, Australia, in 1975, mathematician, Terence Tao.
Okay.
IQ of 230. Off the charts.
What?
Isn't that scary?
That's incredible. That's like the
What does that
parts per
imply?
billion percentile.
Yeah, that's insane. Highest
Yeah.
IQ measured so far.
Wow.
So-
I was thinking it was some like sheep farmer that used to be a bouncer or something. There's a story. There's a Wikipedia article on him. It's true. It's like crazy. His IQ is I don't think it's 200,
Yeah.
but yeah, a lot of times he's lauded as being like this, smartest man on earth with the highest IQ.
Crazy.
Every time the discussion of IQ comes up, in fact, half the discussions I have all trace back to the movie Idiocracy because it's just my favorite.
One of my favorites I like
about
to
how-
use. Yes, exactly.
Yeah, they selected this guy, Joe, just because he's so average. I mean, average in every conceivable way. And they just put up these beautiful, normal Gaussian, bell curves. And he's just right in the center. His IQ is 100 because that's what the average IQ is. He's so I'm pretty much Joe, I think.
Yeah, me too. Oh, that's awesome. All right. So I have a standard question for all of our guests. I use an alliteration for this, right? So the most memorable metrology moment, what I call a 4M. What's your 4M
Okay.
in your
most
career?
memorable-
I know it's hard to pull that up, and just give it a second.
Holy smoke, memorable. Well, this pops into my mind because I remember it was the most shocking moment. So shocking moments tend to stick out,
Sure.
So most memorable moment, man, this is going to sound cheesy, but so NASA gives an award called the Silver Snoopy Award.
Oh, yes.
Right? Yeah. So they give this award in a pretty unusual way, and that is they don't tell the recipient anything about it, right?
Yeah.
So I just have this memory of one day I went to work at at Kennedy, and there was some meeting that everybody was called to. So we go to the headquarters building, which is just a couple of buildings down from where Howard and I worked at the CIF. So we all go up on like the second floor. I don't know what it was of the headquarters building. And everybody's sitting around, and there's I don't know, probably 30, 35 people or something like that in there. And so they come in and they have this, so an astronaut comes in and they just start reading, all of this like bio.
Because it's an award selected by the astronauts.
Yeah.
Yes.
Yeah. And so they're reading all this stuff and you're like, and they're talking about like hobbies and stuff. And you're like, oh yeah, that's because some guy, has a lot of the same interests. And then they they announce your name and give you this award, and you're just like caught completely off guard with zero preparation. And unbeknownst to you, they've contacted your family members. So your mom is there, your family is there, and everything. And you're just like, what happened?
Yes. What a great moment.
Yeah.
No, I was not still there. I had left in 99. So that must have been after that.
Okay. Yeah, it was had to be right around there, because soon after, I know we moved down to Patrick Air Force Base after that. But but most memorable, just memorable,
Quite
not
an
because
honor.
of, you know,
Quite
just
an
a
honor.
shocking moment. And I know it's tough to believe, Chuck. Howard kind of knows, you know, the two versions of Paul, but you know, one version of Paul was super shy and never said 3 words and was very quiet all the time. So it was just particularly shocking to me for that reason, because, you know, in those days I was just,
but you get him talking, and he is full of verve and panache. He is just passionate.
I don't know what those words mean.
I love it.
Yeah. Wonderful. Okay, next question, Howard. But you have 4?
So I did want to come back to your skills as a musician. I know you play guitar. Recently, you said you started picking up the drums, right?
Yeah, that's your area of expertise there, right?
I love that's what I always wanted to play. My parents didn't want me to have the noises in the house, so they gave me the hand-me-down from my brother, the trombone.
Yeah,
and I played that from 3rd grade all the way through high school in the jazz band. I loved the jazz band. That was fun.
Oh, that's awesome. Yeah.
But how about you? Did you ever have a band, or did you ever play out anywhere?
You know, a few times in high school, we actually we played, you know, some parties at some clubhouses. I can tell a few stories about that. Some, you know, at apartments, some graduation. So we graduation party, apartment clubhouse party. I grew up in a town called Melbourne, so we actually did play at the Melbourne Art Festival. It was like, you know,
that's awesome.
The biggest public performance. But I was petrified. You talk about stage fright. Oh my gosh, you know, that's a hell of a thing when you're just, you know, in our band at that time, we were a 3-piece band. So, you know,
like Rush.
And, yeah, exactly. Power trio, right?
Like Rush.
Power trio. That's we were not like Rush. But yeah, that was a terrifying experience. And, you know, I knew right then I just did not have what it takes in every regard, particularly talent, but certainly, you know, I'm not one of those guys that just lives to, you know, jump out on stage and act a fool in front of, you know, a bunch of people. That's the other
side of Paul, right?
Yeah, man.
So my scary moment like that was in high school. We had pulled together this pseudo band, and they had Battle of the Bands.
Yeah,
right? I don't know if your high school did that, but in Chicago we did.
Yeah.
So we were getting ready for that. We had horns. My girlfriend at the time was lead singer. We were doing a Doobie Brothers song. Listen to the music, right?
Yeah, great song.
So we set up to do that. Well, before we were setting up while the other band's playing, the guys were trying to tune their instrument. And the guy we had on the band that played trumpet showed up just plastered. He was drunk, right? Didn't know this guy had this problem at a teenage year, right? Come on, really? It's like 17 years old. Anyway, he ends up tuning them out the wrong direction, every which way. So when we get to start playing, everything's out of tune. It was so embarrassing. Of course, we got booed off the stage. So once I got over that, everything else was good.
Yeah. Yeah. That's a trial by fire, you know.
Oh, it is.
The acid test.
Yeah. Awesome.
Well, it's been a great podcast, guys. Absolutely fantastic.
Love talking with you, Paul.
Yeah, same here, Howard. I know we caught up a bunch, probably more than we should, but it's just so great talking with you.
It is.
And you too, Chuck. I just I love you guys, man.
Well, Paul, I'm telling you, we're going to have you back, more than, half a dozen times, definitely, because it's clear, and it's your knowledge base has to be explored greater. And in all sincerity, there's so much knowledge that we need to get out to the public, to the metrology community, and we're hoping that we can use this media to drive that to it. That's the intent here. But hey, I want to share with our audience, remember, proficiency testing is still the most reliable tool that the metrology community has to validate the technical competency of an accredited organization. Without participating in a proper proficiency test, you cannot prove your technical competency. So enroll in proficiency testing. It's what you need to do. So with that being said,
thank you all for joining us.
We're going to call it a day, and we look forward to the next episode
3 of season 1. We'll have another guest from our board.
Yeah, awesome. Yeah, look forward to it. Thank you, guys. I really appreciate it. It was really fun.